How's the audio? Are we getting it? Check, check, check.
Good?
I'm so fidgety.
Hi. No pressure, all these cameras and microphones on me.
I don't know what to do with my hands.
All right.
My words of wisdom for you trying to avoid pain while awaiting your joint replacement surgery would be to stay active.
If you have access to a pool, that's a great place to be to decrease the load on your joints and decrease some of that pain. If you don't have access to a pool, maybe a bike, a stationary bike, especially if you're having a hip replacement or a knee replacement. That motion is so good for your heart, for your circulatory system, and also gets you stronger, which improves your outcomes after surgery.
By staying active, you improve the lubrication in your joints, which is helpful in decreasing your pain, and those activities also help maintain the strength. The more strength you have, the more it protects those joints.
The other key thing with that though is also make sure that you're not forcing yourself to keep moving through your pain. So kind of finding that healthy balance between rest and activity.
Also, nutrition is important.
Getting in high quality fats, proteins, lots of fruits and vegetables, cutting out alcohol, nicotine.
Processed food, sugars, all of that is not good for inflammation within the body. If you need some help getting on the right path, figuring out what should I eat, we have a bunch of resources here. Sweet Spot Nutrition is a local one, and they can help you with changing up your diet so you're eating foods that are good for you, will make you feel better, and then those tools you can use to help you in the healing process after surgery. Then the third is ice.
Heat and ice modalities, so heat before you go out for an activity, ice once you are done.
This is something you'll definitely be doing after surgery, just 10 to 20 minutes of icing a particular area and then taking 10 to 20 minutes or more off.
Taping and bracing, right? Two simple yet effective tasks. So there's KT tape, nice and simple, gives you a little bit of a cue, a little bit of response to say I'm falling out of posture, I should kind of go back into what's good for me. Some bracing options, same thing. There's levels that go across bracing. Something as simple as a knee sleeve, compression sleeve to give you a sense of security. Ideally, I go see a physical therapist, come see somebody who knows what they're dealing with. You have an idea then of what you can do, what you can work on, ways that work for you. Definitely things that we can educate you on that are gonna buy you that time until you have surgery.
One of the things that I recommend is to start the physical therapy exercises you're going to be doing after surgery, but do them beforehand. Doing so helps to increase strength in the muscles, helps to promote range of motion, and most importantly, it's good to get that motor program developed so that you know this is what I'm going to be working on after surgery.
Movement is a really big causative factor that can really lead to some pain, whether it be bending down to pick something up off of the floor, reaching up overhead. These are things that over time our body's tissues negatively adapt to that, and injury can occur.
It might be something as simple as cutting back a little bit on one movement, doing a little bit more of the other, or modifying how you pick up groceries, how you put stuff away in the house.
Try to figure out the reasons why. If you can figure out the why behind why you're moving a certain way, sometimes pain can decrease or even go away completely. When you go and see a physical therapist, they're able to identify these movement faults to really help, one, fix them and help you move better to get out of pain, but two, these are things that even after you're done with your surgery, we have to remember these things, because if we fix the tissue that was affected in the first place, but we go back to moving the same way, right? These are things that you're gonna go right down the same exact path.
I think the biggest thing I would recommend is talk to other people who have had the procedure. Talking to some of the health professionals, whether it's the doctors or the nurse case manager or the physical therapist, to find out how bad is it going to be and for how long, and what measures I can do in that time to make the pain as tolerable as possible.
Good luck with the whole process.
If you're also looking for more information about joint replacement surgery, you can go to stevenspointortho.com and click on the Joint Journey tab. And there you will find some testimonials from patients who have undergone joint replacement surgery and have gone through the rehabilitation process, and they can help maybe answer some of your questions about what to expect.